Hello, everyone, and welcome to the SNAPS COVID-19 office hours. My name is Micah Webster with Apt Associates, and I'm going to spend a couple of moments going over some tech notes, and then we'll get into the content that we have for today. So just a couple of housekeeping reminders. We are recording the office hours today, as we do for each month, and we will post a copy of the recording along with the slides and any content that we receive through the chat box onto the HUD Exchange in just a few business days. If you have any issues with audio during the webinar, we encourage you to switch over from computer to phone audio at the numbers that are up there on the screen and that I've just pasted into the chat. Everyone will remain muted for the duration of the office hours this month, but we absolutely anticipate and hope to hear from you through the chat feature in WebEx. To find the chat, just take a look at the bottom right-hand corner of your screen. You should see the word chat and what looks like a message bubble. Click on that to open the chat. Please send all questions, comments, and feedback in the chat. And with that, I'm going to turn things over to Norm Suchar from the HUD Office of Special Needs Assistance Programs. Norm?
Thank you, Micah, and welcome everyone to today's office hours. I want to let everyone know that we have a fairly short set of presentations today, but some really interesting and important content. But what a short presentation means is that if you have any questions you'd like to ask us, we should have plenty of time to go through questions. So as Micah mentioned, please go ahead and type those questions in the chat window and address them to everyone, and we will do our best to answer them as quickly and completely as possible. Just want to quickly let you know who's on the call today. We have a lot of people in the background who are going to be ready to answer any questions you have and post resources along with the content for today. Our featured presentations are from Emily Masitis at the Centers for Disease Control and Prevention. Emily will be talking about, will be giving us a COVID and Mpox update, and also be talking about a fascinating new paper that I think you'll all find very relevant and interesting. We will also have a presentation from Sharon Singer from the SNAPS office, giving us an update on ESG-CV. We are quickly getting to the end of the ESG-CV program and want to share status updates with everyone and give you all information about how it's going and some of the next milestones or things you should be paying attention to. So with that, I'd like to turn things over to Emily Masitis from the CDC. Emily, it's all yours.
Hi, everyone. Thanks so much, Norm. I will jump in with a couple updates. Mostly it is, unlike CDC updates, it's kind of good news. So we'll talk about COVID and Mpox, and then I'll talk a bit about that study that Norm mentioned. So next slide. All right, so last month, the public health emergency for COVID-19 ended. That changed some of the data streams that came into CDC, which means that now we don't have daily counts or weekly counts of cases. What we're tracking is hospital admissions. That's the primary indicator that we're looking at to get an understanding of what the burden of disease looks like. It's a helpful indicator because it tells us more about severity and what's going on there, rather than just lots of cases that might not have a meaningful public health burden. For example, you might know people right now that have COVID-19 and they are fine. They are able to access medications. They've already been vaccinated and their cases are not severe. So our hospital data tells us what do the severe cases look like, and those cases have been coming down, or those admissions have been coming down since about December. So we're still heading in a good direction with that. If you go to the next slide, you can see we changed, because of the change in data streams within CDC after the change in the emergency declaration. This map is now also based on hospital admissions instead of community levels. Previously, those community levels took into account, it did take into account hospital admissions, but also cases and some other indicators. So now we're just looking at hospital admissions. And you can see that we are in the green pretty much across the country. There are just a couple counties that have orange levels and a couple that are in the yellow zone. So it is still important to know if you're in an area where you might have some burden of COVID-19. The shelter guidance is reliant now on this information rather than the COVID-19 community levels. So do keep in mind that you can still look at the county level information here, and that there may be interventions at homeless service sites that might need to change based on what's going on here. Next slide. All right, also pretty good news in MPOX. We have, this is data just from this year. So this doesn't take into account the big bulk of cases of MPOX that happened in August of last year. It's been coming down since then, but there was a concern for a rise again this spring. So I wanted to highlight that there have been two kind of additional peaks in this spring that have happened. These dates, for some reason, at the bottom are totally illegible, but one was in March and the other one was a couple weeks ago, that we've had a couple days where we're getting up in the more 8 to 10 cases range rather than what we see at our baseline around, 1 to 5 cases of MPOX per day. Some of these have been in people who have been vaccinated. It's clear that it is possible for people to get MPOX after they've been vaccinated. The expectation is that the severity is likely lower, and also that it's less likely to pass it on to other people if a person gets a case, if you were to get a case of MPOX after you've been vaccinated. So still really want to make sure people are getting vaccinated, and we are continuing to track this information to make sure we know what's going on. But the positive thing here is that we didn't see these bubbles kind of turn into a bigger trend, and we hope that it won't over as we move into the summer. We hope that these are some isolated clusters that have come about. We do need to know that it's still circulating, people can still get it, but we are not seeing an upward trend right now, which is great news. All right, next slide. Okay, so I want to talk a little bit about this paper. It came out in April, and I think Caroline, when she was on, she might have mentioned it, but I want to give a couple more details of why this matters and why we are thinking about it a lot and thinking about the implications. This is a quantitative modeling paper on displacement among people who are experiencing unsheltered homelessness. This is really important to us within the public health field because data are the fuel of public health. Public health agencies can't really weigh in or put input into things if there aren't rigorous data. So one of the most important things right now we need to do is look at what data, and I'm talking quantitative data right now, because we need qualitative data as well, but in this space, we really have a dearth of information on quantitative data. So we really need to build some quantitative data around unsheltered homelessness and public health. So with this paper, we had the opportunity to collaborate with the University of Colorado, National Healthcare for the Homeless Council, and others to publish data from a simulation model that projected the long-term health effects of involuntary displacement. This could include sweeps, it could include encampment clearings, or move along policies, any kind of involuntary displacement. And importantly, that involuntary displacement is not paired with any continued connection to services or to housing. It's just a request or requirement to move. So a person has been told, you are in this location, you may no longer be here, you must move. And maybe that could be paired with removing their belongings, and it could be with no notice, it could be with short-term notice, something like that. But it's an involuntary displacement that is not connected with services. So this particular group that we were looking at here was in people who are experiencing homelessness and also who injected drugs in 23 cities in the United States. Simulation modeling, people have a lot of thoughts about how useful simulation modeling is. But I can say the phase that we're at right now, looking at unsheltered homelessness and public health, simulation modeling is a really helpful thing because there are a couple studies that show harms of displacing people involuntarily, but they are geographically dependent and they're a bit piecemeal. So they don't give us a big picture understanding of what does displacement mean and what does it do over a long time period. That's where a model, a mathematical model, can fill in the gaps using those pieces of data and then using a lot of population data as like the underlying population for the model. The modeling work can fill in the gaps to paint the picture of what happens over a long period of time. So our baseline population data came from CDC. It came from populations that were specifically people experiencing homelessness and who injected drugs in these 23 cities. So it gave a lot of baseline information about behaviors, demographics, all those things fed really robustly into the model. And then these smaller studies told us what are the associations with displacement and health outcomes. And that all fed into the model and told us that over a 10-year time period, there was no situation where displacement was beneficial to health over thousands of runs through this model. And essentially, there was almost no situation where it was just even neutral. In all situations, displacement was causing harm. So what we saw was a 150% increase in overdose mortality over the course of 10 years. And what this led to in these projections was an overall decrease in life expectancy, a meaningful, like 25% decrease in life expectancy for people who are exposed to a risk of involuntary displacement compared to people who were not exposed to that. So this helps us, again, as I said, understand the big picture of public health impacts of displacement without services. It highlights a problem. It does not tell us solutions. So that's really the next step. The next step is understanding what needs to come next. What do we need to do to protect the health of people who are experiencing unsheltered homelessness when we know that unsheltered homelessness is associated with great risks on its own? What are the solutions that we need to put into place to help protect people's health that do not increase their health risks like it appears here that displacement does? I will stop there. The next slide, I think, is just our contact information. And we do have a special populations box that I can share that email address as well in the chat. If anybody has specific questions for us, but also happy to answer questions now.
Thank you so much, Emily. There is a question in the chat window about are any of the cities in the Bay Area and are any of them based in rural areas? Maybe you can talk generally about what is in the paper, so when people click on the links, they can kind of know what they might find there.
Yes. So the Bay Area should be represented in some way. I haven't looked exactly for which jurisdiction that is. It might be just San Francisco, or it might be broader. It will be in the supplemental table. So if you click on the paper, right on the right side, it should say supplemental information. And then you can see the specific data for each city. And then in terms of rural areas, I don't know what the smallest city is that we have, but I don't know if anything would be considered rural because it is all city data. So I want to say, we're getting into, there are moderate sized cities in there, but I don't think there's anything that would be considered a rural or a very small city. But that's a great point because that can change, the way that these things play out.
Thank you. So the headline number, 151% increase in overdose mortality. So you're basically looking at 2.5 times as many people dying, is quite stark. Can you talk about like what is the modeling saying is happening? Like what is causing the additional mortality in the paper?
Yeah, so the what the model does is it takes these other studies that were primary data among people who had been displaced, where people who had been displaced were asked questions about what happened to them in the process of displacement. And what those other studies have found is that the risks related to substance use. This is also very specifically honed in on substance use and also injection related infection. So that's important to keep in mind because there's other outcomes that are not accounted for here. The relationship between there's a relationship between displacement and initiation of medications for opioid use disorder. There's a risk of a connection between displacement and overdose, fatal and non-fatal overdose. And so those risks, which were found in smaller contexts, then can be applied to understand what happens if this situation occurs over a 10-year period. So that's the base like parameterization data that's going into it. It's not necessarily that the model says this person has been displaced or this person hasn't. It's actually what's actually modeled is now this person in the displacement scenario, now this person has this additional risk of not initiating medications for opioid use disorders. So then what does that mean for their subsequent hospitalization and death? And so that's how it all feeds in together to create this estimate.
Thank you. I find that very enlightening how, displacement really disconnects people from a lot of things, their support networks, their service networks, and I think that happens generally, and clearly it happens among people in encampments and unsheltered locations as well, and that has some fairly stark negative consequences. So thank you very much for sharing that. If you have any more questions for Emily, please go ahead and type them in the chat window, or I think the email box will come up in a sec if you have any follow-up questions after this session. So with that, we're going to move to our next presentation. I'd like to turn things over to Sharon Singer from the SNAPS office, and Sharon's going to give us some updates, as you can see on the screen, about the ESG-CV grants and about the closeout process. So Sharon, over to you.
Hey folks, happy Friday. And I'm just gonna go over some of the regular slides and then add some additional information. If you wanna go to the next slide. So we are continuing to see bump up in the draws over 80% and some folks getting to 100% already. We had 11 more recipients that are over 80% drawn and 10 more that are in the 60 to 80. We have the same folks in the 0 to 20. We're hoping they make it out of there. They know who they are. So we're having some movement, but it's been slow going this last week. If you want to go to the next slide. We only had 9.4 million in draws this week, which is a downward trend from the last couple of months. So we really, for folks who are on here, who are working on this program, please work with your peers to try and draw these funds. The September 30th deadline is coming soon. So we still have some reallocated funds that are not committed in IDES, but we're almost there. And so we are, like I said, we're making progress, but we still have folks who are behind in their quarterly reports. It's really problematic if you are drawing funds and not reporting them, because then we don't know what you're spending your funds on, and that's a problem. So for the 49 recipients who are behind on quarterly reports, we really need you to move those along. And we are going to be doing some initial outreach. We've already been doing outreach on quarterly reports, but for folks who are really far behind on their draws, sort of below 50%, we're going to be doing some outreach, as well as some recipients with very large balances. So expect to hear from your CARES Act staff in the near future. I'm going to go to the next slide. So as I said, draw rates have been down. We do have these large balances. We understand that some folks have gotten reallocated funds, and those funds don't have to be expended by the September 30th date, but all their other funds do. So those reallocated funds are separate and have a separate deadline from the originally authorized funds. And you have an additional 3 months to get the HMIS and admin funds for closeout. So you want to be preparing for that thing. So again, if you have concerns, please reach out now. If somebody could put in the chat the link for technical assistance and the AAQ, that would be really helpful, because that is a great opportunity to get some specific assistance at this point. I'm going to go to the next slide. So just as a reminder, I think I've shown this before, that these are the deadlines. So the September 30th is obviously the nearest date. The draw deadline is beyond that, but ideally you would be drawing the funds at the same time that you are reporting them. And so you do have time to get your final quarterly report in, but if you are ready to do that, we are ready to get them. So the admin funds have till December 31st, and then the reallocated funds till June 30th. And as I said, those funds are separate from the initial funds. Thank you for putting that in the chat. So hopefully folks have this handy, and we will be resending this to make sure that it's on people's minds. If you want to go to the next slide. So the closeout process, you should be receiving an invite for a closeout webinar for the 27th of June. And like I said, that should be coming out soon, where we're creating a checklist with our TA providers to make it hopefully as simple as possible to close out. If you have drawn all your funds, you can close out your QPR reporting, and we will also be having a webinar for that, but there already is guidance posted in Sage and on the HUD Exchange. And when you get the slides for this, you can click on the office hours or get the guidance on the HUD Exchange. So again, hopefully that's pretty straightforward for those of you who are in that camp already. If you want to go to the next slide. So grants are ready for a closeout. It's pretty straightforward. Like I said, expended and drew all the grant funds or returned any remaining funds. Eligible activities are, all activities are eligible and were therefore then completed. Submitted final QPR, that HUD has determined the report satisfactory. I do want to make a comment that, and this is maybe a problem on our end, some folks have reported that they have expended more than 100% of their funds. And it's not a common problem, but it means you need to go back and recheck, because obviously you can't spend more than 100%. But it may just be an accounting error. So that is something, unfortunately, our system doesn't stop you from putting in more than 100%, but we will work on trying to fix that. But in the meantime, please be cognizant if that has happened. You need to expend all the funds during the period of performance, no open audits or monitoring findings. I know some folks are getting monitored right now by the field office. And anything else, any other responsibilities under the grant agreement have to be carried out. So hopefully pretty straightforward. And we will go into more detail on the webinar with the checklist to help folks who are ready to close out. And you want to go to the next and last slide. So again, with the QPR submission, you know, hopefully that is pretty straightforward, and we will have a webinar to go over the guidance for folks who are there. So as I said, if the recipients who are behind on their quarterly reports can please update those. We have a team ready to help you with that if needed. We also are here to help if you are having programmatic or other issues in spending down your funds. But a lot of states have huge balances. And so we are eager to see those numbers go down. And so we just, as we have been saying for a long time, to keep spending and reporting that work. We know how much work has been done, and we want to make sure that you get credit for that and that people are continuing to be helped with the dollars that are remaining. So I am going to pass this back to Norm, and you can let me know if there are any questions.
Thank you. No questions about this particular topic in the chat, but I did want to follow up with a couple things. So for the closeout process, you explained about the webinar and how people can get additional help. If people are panicked that they may not be expending enough funds or that they may end up having to give funds back to HUD, do you have any advice for where they should go to get help or how they should be thinking about that?
Yeah, so there are a variety of folks who can help. Jennifer put in the chat to submit an AQ if there is sort of a very targeted question. There also, I can put in the chat the request for technical assistance and how to do that in the HUD Exchange. If you are already working with your regional team, that is one way to go about it, because that is somebody who's already assigned to help you. And we have a team specific to states, so that if you are from a state, they have a meeting that is happening next week on Thursday, the 22nd at 1 p.m. There is the state recipient office hours. So I would encourage, if you are not on that list and want to be, you can put that in the chat and I'll make sure that you get on it. But that has been very helpful. But that work is also winding down. So as far as some of our TA work is winding down, but we are still here and the TA providers are still able to help you.
Great, thank you. And I would, I know that it's always a challenge to sort of like spend the final dollars in a program or, you know, go through all the process. We know it's about more than just like actually serving people. There's a lot of paperwork and such to be done to get all these things through. We do encourage you to do that as quickly as possible. Last year there was a lot, or not last year, but when we were at the intermediate expenditure deadlines, there were a lot of sort of hiccups that communities had in processing draws, and we want to avoid all that. So it's helpful if you get in early. We are definitely eager to converse with you, to jointly problem solve with you, to work with you to figure out how do we sort of make all this work. And that's the case if you are a subrecipient, so you're, you know, getting funding from your state or jurisdiction, or if you're a recipient, we want to help you, sort of finish off this program and finish utilizing these amazing resources. So thank you, Sharon, for that. That's great. We have a few questions in the chat window that I want to talk about really quickly, or in a normal amount of time. One question from CJ, will there be new DV funding in this year's annual NOFO? Yes, there will. We got another allotment of $52 million from Congress, so that will be part of this year's COC NOFO again. Somebody's asking about the final deadline for YHDP proposals. It's coming up. It's later this month. I want to say June 27th, but we'll post something in the chat window about the final deadline there. But it's coming up, so if you haven't finished that, please do that as quickly as possible. We're very excited to have another round of YHDP communities. We have another question about for communities that received funding under the special NOFO, when would funds likely arrive? We encourage you to reach out and talk to your field office, because those, you're going to work with your field office, obviously, you know this, but to execute those grants, I believe some of those grants are ready to be executed, not all of them, but some of them I believe are ready to be executed. So work closely with your field office, and at the very least, there are issues and conditions and other sort of post-award steps that you can be working on to sort of get the grant ready for execution. But very excited that you are eager to get moving on that. We are very excited about this program. We have a question from Helen about, will YHDP renewals be non-competitive again this year? As we haven't published the NOFO yet, can't really talk about the details. So stay tuned for the NOFO, and it will spell everything out. Question, I wonder if William's on, and maybe William, you can answer this question about, does the HMIS lead need to assist with the QPRs? Not actually sure William is on.
This is Sharon. I can just say it depends. It depends if they've already run the reports for you that have the data that you need. It is often the case that the HMIS person does lots of anything computer related for an office. So I think it depends on the capacity of your team. You also need to, make sure that as I was saying earlier, that whoever does the numbers in your office, who does the accounting and budget, is also engaged. So I would say if they've run the reports for you that have the data you need, hopefully they don't need to be engaged.
Thank you. And great. And thank you, Ebony, for confirming that the due date for that is June 27th. So I think we're done with the questions that we're able to answer at this point. Rebecca asked about the Inspire rule. I can say that we will be providing guidance later this summer. The rules go into effect, the Inspire rule goes into effect for our programs on October 1st of this year. I can say that there likely, fewer changes for our programs than for some of the other HUD programs, but we will spell out all the sort of expectations and changes. Mainly they have to do with the actual standards that are being utilized. So, but we will have more information about that soon. Sorry, we don't have anything quite yet. We've been trying to focus on getting the NOFO out because we know everyone's excited to get working on that. So with that, I want to thank everyone for joining today's office hours. Want to very much thank our presenters, Emily and Sharon. And I want to thank all of you for joining today and for the incredible work you're doing on ending homelessness in these very challenging and trying times. So I want to wish everyone a great rest of the day, great weekend, and that concludes the webinar.